I've had the good privilege for many years of having the opportunity to teach both faculty, students, and residents on how to be better teachers, in addition, how to be clinicians. And I often find ourselves in this setting making a comparison. This teaching skill is very similar to how you take care of a patient in this setting, or the way you ask questions here are very similar to the way you might ask a patient that sort of question. And it dawned on us, is there a parallel to this that's deeper than we've appreciated? Can we uncover something that might make it clear to us that teaching certain educational skills will make our residents better physicians and our students better physicians so they can take better care of our patients? Our project's trying to uncover relationships between teaching and clinical care. We intuitively know that individuals who are good teachers tend to take better care of their patients, but it's never been studied. So we want to answer two questions. One, is there really a link between teaching and clinical care? And two, if we take a group of individuals and improve their teaching skills, do they also improve their clinical care? And can we measure that? Over the last few years, we developed a program called the Clinician Educator Track. Within this track, we allow a small group of residents to develop their skills as medical educators. And we want to determine if these individuals become better clinicians as well. Can we uncover some similarities between the skills that are needed as teacher and those that are utilized in professional competence within internal medicine? We've designed this study to have both qualitative and quantitative elements. For the qualitative part, we're looking at the evaluation of our learners, trying to determine if in their clinical evaluations, if there are comments made that parallel things that we teach our teachers and how to be excellent teachers. Skills such as giving feedback appropriately, communication skills, critical thinking, how to teach in small groups effectively, how to teach in large groups and give lectures, how to show compassion and empathy for your learners. All things that we also talk about in providing care for our patients. From the quantitative aspect, we're again looking at the evaluation of our learners. Our learners have many evaluations in any given year from multiple arenas, nurses, faculty, peer evaluations. And within these evaluations, we ask questions not only about their clinical care, but their teaching skills, because we know that the teaching that our residents provide is important, not just for teaching each other, for their own learning, but also for teaching of medical students. We're going to take these evaluations and determine if those residents who are in our Clinician Educator Track improve their teaching skills compared to a control group. And as our teaching skills improve, do their clinical skills improve at a similar rate? And compared to the control group, as their teaching skills improve, do their clinical skills outpace that of the control group? In the end, we hope to be able to understand the correlation, and if there's a correlation, between teaching and clinical care. We hope to be able to say there is a correlation, and that if we make an individual a better teacher, their ability to take better care of patients is enhanced as well. And if we can prove this, we might want to put more emphasis on our teaching of our students and residents and faculty to be better teachers, not just to help in the education of each other, but also to help in the care of our patients.